Hello everyone, I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to Ask Me, our monthly sessions where I answer your pressing questions about eye care. Today's question is, Dr. Mattis, my mother was recently diagnosed with glaucoma. She was informed by the ophthalmologist that glaucoma is hereditary and I should get tested. Are my children and I at risk of developing glaucoma? What can I do to prevent glaucoma? Well, glaucoma is a very huge topic. It is a very common disease, eye disease worldwide, and it is actually the leading cause of irreversible blindness in Jamaica. So today, I hope we can dispel some of the mystique about glaucoma, and you will leave here getting some understanding of what glaucoma is. I don't want to give too much information so that you're overwhelmed and not understand. And I also don't want to give too little information because at the end of the session, you should have a good idea. So we're going to try for the Goldilocks rule. Not too much, not too little, but just enough. Now, what is glaucoma? Glaucoma refers to a group of diseases that can cause vision loss and ultimate blindness by chronic progressive optic nerve, meaning the eye nerve damage. There is also a specific pattern of visual field loss, and it is also associated with raised intraocular pressure, usually, but not always. Now, as I said before, damage to the optic nerve is irreversible. That is so because the optic nerve goes straight to the brain. It is part of brain tissue, and whenever there's damage to brain tissue, it cannot be regenerated. Now, glaucoma has no noticeable symptoms in its early stages, and the vision loss progresses at such a gradual rate that the persons who are affected by the condition are often unaware of it until their sight has been already compromised. So what causes glaucoma? One of the major risk factors is the pressure in the eye. Now, an abnormality in the eye's drainage system can cause fluid to build up. Now, the fluid that builds up is not tears, as patients have asked me before. It is a fluid that is produced by the tissue in the eye, and that fluid is responsible for the oxygenation and the glucose and just nourishment of the eye. And when that fluid is formed, it has a passage to drain out of the eye. New fluid comes in to cause, it's a cycle. So when that fluid builds up, it leads to excessive pressure that causes damage to the optic nerve. Now, that's not the only cause, but it is an important cause, and it is the only treatable cause. So I mention that now because we'll talk about it again when we go on to talk about treatment. Now, what are the types of glaucoma? Now, there is what we call primary glaucoma, and primary means the cause is unknown. And we have primary open angle glaucoma, and we have primary closed angle glaucoma. Then we have another category called secondary glaucoma. Now, secondary glaucoma occurs due to a known cause. For example, medications such as steroids, the same steroids that, this may be controversial, that we actually, persons use it on their face, apply to their skin, steroids that you can take by mouth. That's a known cause of causing increased pressure. There are certain eye diseases that may cause glaucoma. Diabetes also as a condition may cause glaucoma. And so too may eye injury can cause glaucoma. The list is inexhaustible, but those are some of the common causes. Now, secondary glaucoma can be open angle or closed angle. And then we have congenital glaucoma. Congenital glaucoma means babies that are born with glaucoma. And that's a whole new topic by itself, which we are not going into. The most common type of glaucoma is open angle glaucoma. Now, closed-angle glaucoma is less common. However, it can come on immediately and require a trip to the emergency room, and we'll come into that when we talk about the symptoms. Now, who is at risk for glaucoma? Is glaucoma hereditary, as was asked in the question? Now, some persons have a higher than normal risk of getting glaucoma, and that includes persons who are over the age of 40, have family members with glaucoma, persons who are of African or Hispanic or Asian heritage, and persons who have a high pressure in their eye just by virtue of measuring. Nearsighted and farsighted persons also carry a higher risk of glaucoma. And as I said before, persons who have had an eye injury, they can get glaucoma. Other risk factors, as I mentioned before, long-term use of steroid medications, and as I said, steroids also that is used in the bleaching of the face. Diabetic patients, they get a special type of glaucoma. Persons with migraine, poor blood circulation, and other health problems affecting the entire body. What are the symptoms and signs of glaucoma? With open-angle glaucoma, there are no warning signs or obvious symptoms in the early stages. Now, as the disease progresses, your peripheral or side vision may be affected, but you may not be aware of this. Most persons with open-angle glaucoma do not notice any change in their vision until the damage is quite severe. This is why we call glaucoma the silent thief of sight. And if you don't get anything else from this session today, open-angle glaucoma is most common, and it rarely comes with symptoms until it is too late. Now, closed-angle glaucoma can present suddenly, and you get the following. You can get severe pain in one eye. You get decreased or cloudy vision, nausea, vomiting, a rainbow or halos around lights, and you get a red swollen eye. Now, this comes with all the bells and whistles, and of course, this will cause you to rush to the emergency room, because this type of glaucoma is due to a sudden blockage of the drainage system. So when we have drainage and it becomes blocked suddenly, the intraocular pressure rises suddenly. So it goes from the normal of between 10, 20 to sometimes 50, 60, 70 millimeters of mercury. And this causes severe headache, severe sickness. But as I said before, it is a less common type of glaucoma and not common in our population. Our population tends to have the silent, no symptom glaucoma, which is our open angle glaucoma. To summarize, what happens if you have glaucoma? You have optic nerve damage from the buildup of fluid in the eye, and if left untreated, this eye pressure can cause a permanent vision loss if the damage continues and progresses. Now, how do we diagnose glaucoma? The only sure way to diagnose glaucoma is with a complete eye examination. And during a glaucoma eye examination, your ophthalmologist or eye care provider will measure the pressure in your eye. The drainage angle will also be inspected. And the specialist will actually look at the optic nerve for damage. Sometimes we'll test your peripheral or side vision, but those tests are late. Trying to detect it early, we can take a picture or a computer measurement of the optic nerve. We can also measure the thickness of your cornea, that is the structure at the surface of your eye, because it can give us some information as to the pressure of your eye as well. Now, what do we do to treat glaucoma? As I mentioned before, glaucoma damage is permanent and cannot be reversed. But Medicines such as eye drops and sometimes tablets and surgery can help to stop further damage. To treat glaucoma, your ophthalmologist may use one or more of the following treatments. Eye drops, which is the most common, and used every day, the eye drops lower the eye pressure. We also have laser surgery, and there are different types of laser surgery depending on the type of glaucoma you have, and your ophthalmologist would guide you along those lines. There's also operating room surgery, where we actually do an operation on your eye to put in drainage tubes to increase the drainage to lower the pressure in your eye. And this new drainage creates a channel for that fluid to leave your eye. None of these treatments restore vision that is lost. The treatment or the treatments for glaucoma are designed to lower the pressure so that it can slow down vision loss and preserve your present vision. The question, can glaucoma be cured, has been answered. No, it cannot be cured. It can be controlled. There is often no early symptom, which is why 50% of patients who have glaucoma don't know that they have glaucoma. Your vision can be preserved if glaucoma is detected early. What can I do to prevent glaucoma? As I mentioned before, for the most part, it is a hereditary condition. And the only way you can prevent progression of glaucoma, if you will, is to have early examination so that we can detect your intraocular pressure. All adults should have a complete eye examination by the age of 40. Why age 40, you may ask? I will give you a case of a patient I had some time ago. Now, this patient presented, she was approximately age 55. And she said to me, Dr. Mattis, my vision is dark. I have my reading glasses and it was doing well before, but now I cannot see even with my reading glasses. And she admitted that she went to the store and she bought a pair of reading glasses. Now, I'm not saying going to the store to buy a pair of reading glasses, anything is wrong with that. But at age 40, we develop a condition where we lose the ability to see near or fine print, and we have to get reading glasses. So it is a watershed period. And if at no other time you have your eye tested, at around that time when you're going to get reading glasses because you need them, you should have a comprehensive eye examination. And I can tell you, I have detected a lot of patients with glaucoma when they come in complaining that they can't see fine print. So back to this patient. So when I examined her, it turns out that she had severe, what we call end-stage glaucoma. And as I mentioned before, and I mention again, the vision loss cannot be restored. So she had severe 80-90% of her optic nerve gone, never to come back, because she had glaucoma and she did not know. So if you are at risk for glaucoma, you should have an eye examination sooner than age 40. And you should have regular eye examinations recommended by your eye care provider. To answer the question, should my children and I be tested because we are at risk for glaucoma? The answer is yes. I do recommend that yourself and children should have an ophthalmic examination. As a general rule, children should be tested at preschool and then at around age 10, 12, if everything is normal, and then again in the teenage years. Again, I say if everything is normal. Outside of that, you're tested accordingly. And certainly, as I mentioned before, age 40 is a watershed period for adults. So if you get nothing else from our session today, there are a couple things that I hope will stick in your brain. Glaucoma is a group of diseases. It is not curable. It can be controlled. There is that hereditary component, but at the same time, persons may not know their family history, so you should get your eyes checked. And we have treatment to control, but not to cure. So I hope you got some information today and you are a little bit clearer on what glaucoma is. Thank you for watching. See you next month for our next insightful session. And remember, if you have a question, just drop them in the comment section below.